What is a saliva drug test and how accurate is it? Have you ever wondered how a saliva drug test works and how accurate it really is? Let's break it down. A saliva drug test, also known as an oral fluid or mouth swab drug test, is a method used to check for drugs in a person's saliva. This test involves collecting a sample of oral fluid using a swab or collection device that is placed inside the mouth, usually under the tongue or inside the cheek. Once the sample is collected, it is analyzed to see if any drugs are present. These tests are popular in substance abuse monitoring and relapse prevention planning. They are non-invasive, easy to administer, and provide quick results. This makes them especially useful in settings like workplaces, probation programs, or treatment centers where recent drug use needs to be verified. When it comes to accuracy, saliva drug tests are generally very reliable if done correctly. Studies show that these tests can achieve accuracy rates of around 97% or higher. This level of accuracy is comparable to laboratory-based testing methods. Advanced techniques, like mass spectrometry, are often used in laboratories to detect drugs at very low levels in oral fluid. However, it is important to note that saliva tests have a shorter detection window compared to other methods like urine or hair analysis. Typically, drugs can be detected in saliva from about 5 hours up to 48 hours after use. Some substances, like tetrahydrocannabinol, which is the active compound in cannabis, may be detectable for up to 72 hours. Benzodiazepines can sometimes be found in saliva for up to 9 days. The accuracy of these tests can vary based on several factors. The type of drug being tested plays a role, as some substances are easier to detect in saliva than others. For example, tests for amphetamines, cocaine, and opiates are generally reliable. However, detecting cannabis can be less consistent. The method of collection also matters. Tests conducted using instant testing kits may not be as precise as those sent to a laboratory for analysis. Additionally, using substances that stimulate saliva production, like citric acid candy or chewing gum, can dilute drug concentrations and affect test sensitivity. Proper administration and supervision of the test can enhance reliability. Tests conducted under observation help reduce the risk of tampering or contamination of the sample. From the perspective of substance abuse and addiction recovery, saliva drug tests are an effective tool in relapse prevention strategies. Their ability to detect recent drug use allows treatment providers to intervene quickly if a relapse occurs. The ease and speed of testing make regular monitoring possible without the invasiveness or privacy concerns associated with urine or blood tests. Despite some myths about cheating saliva drug tests, scientific evidence shows that attempts to alter results are generally ineffective and can lead to serious consequences. Therefore, the best approach for individuals in recovery is to maintain abstinence and comply with testing protocols. In summary, saliva drug tests are a practical and accurate method to screen for recent drug use. Their high accuracy makes them reliable for both clinical and legal purposes, especially when used as part of a comprehensive relapse prevention and aftercare plan. Their short detection window is aligned with the goal of identifying current substance use, supporting immediate intervention, and ongoing recovery efforts.